my name is Kevin Rooker, and this is Renee Patterson, and we're the clinical marketing team at CIVCO Medical Solutions. And today, we're going to show you how to properly use the UltraPro 2 needle guidance system.
A key feature of the UltraPro 2 needle guidance system is the ability to pre-plan your approach. An UltraPro needle guide and bracket have different options for angles of approach. They're going to correspond to the system software. When you activate the biopsy guide on the system, it would allow you to choose an angle that's going to correspond to either a number or a letter, and in this case it's going to be a number. As I'm pre-planning, I scan to find the best approach. I activate the system software and toggle between angle 1, angle 2, and angle 3. I feel like angle 2 is the best situation, so I pull the pin, lock it into angle 2. At this point, we're ready to put on the needle guide. For the simulation, I'm going to use an 18 gauge needle, so I turn and twist the 18 gauge insert, slide it into the needle guide. Going back to my screen, angle 2 still seems to be the best approach. I will insert my needle into the funnel, keeping my hand steady, and into the patient's skin. As I watch my needle track between the guidelines and along the guideline, I reach my area of interest. At this point, if you would like to quick release, all CIVCO needle guides provide this ability. I depress the guide and remove the transducer. If I want to put it back, that's absolutely fine. I press the quick release again and put it back in place.
Now that Renee has demonstrated the proper use of the needle guidance system, I'd like to take a moment to review some of the troubleshooting tips if your needle is not tracking as you would expect it to. First, confirm that you have the correct angle on the bracket and on your ultrasound system software. In other words, if I have chosen angle number 2 on the bracket, I need to be sure that angle number 2 is selected on the system. If I have angle 1 on the system and angle 3 on the bracket, it will not track as you would expect it to. Secondarily, once the needle is in place, we want to be sure we have appropriate pressure with the probe. And once the needle begins to introduce into the patient's skin, we want to be very careful not to move the probe at this point. In other words, if I advance the needle and then I begin rocking the probe this way or this way, then the needle will begin to track outside of what we would expect it to. So again, critical to hold your probe as still as possible once the needle has been introduced into the patient. And third, take this back out for a moment, is we want to avoid this type of approach. In other words, the more distance there is between the exit point of the guide and the patient's skin, the more likely we're going to have trouble with it tracking outside of the line as well. So we want to avoid this type of situation and be sure that we have sufficient pressure and that the exit point on the guide is as close to the patient's skin as possible.
Thank you for joining us. If you have additional questions after watching the video, feel free to contact us at the information listed below.